Okay, it's 9:01. Good morning. Bonjour. My name is Rami Shoucri, and I'm very excited to be part of this important conference, especially during RibFest, and to be the moderator of this amazing panel. I know there are other great panels happening now, but I think you have all made the best decision to join us here. We are here to reflect on some examples of access to justice initiatives intersecting with the health system, and also to reflect on the potential for research and evaluation methods typically associated with health data or the health system that might be applicable to any access to justice intervention. So as somebody who has moved back and forth between the legal and medical system for the past 20 years, I'm especially interested in the discussion and lessons to be drawn, and I think you will also be inspired and impressed as well. So I want to start by introducing the structure of our panel today, as it might be a little different than other panels. First, please note that one of our speakers will be presenting in French, so please feel free to get one of the simultaneous translating devices at the front here if you need. Second, we've decided to split the presentation portion of the panel into two parts. So each panelist will first introduce themselves and their work that brings them to this panel, and then each will share reflections on the theme of the panel regarding evidence and evaluation using health tools. Can't seem to make this move forward. Okay, there we go. Thank you. We did this in order to hopefully facilitate discussion amongst the panelists and with you, the audience. So please do make note of any questions or ideas that arise during the presentations, and we are aiming to leave about 20 minutes for questions at the end. So with that, I will hand it over to our first panelist, Michelle Leary.
Good morning, everyone. So we thought we would start off with a little explanation, as Rami said, about how we came to where we are, because I think all of us are on a journey to think differently about what justice means and what access to justice means. So we thought it probably would be helpful if you had a bit of a perspective about at least in my case, the serendipities that led me to where I am today sitting in front of you. So I was intending to talk about it no longer being a bridge too far and how we might be sharing knowledge about implementing health justice partnerships in Canada. And this is working towards a conference that we're holding on September 22nd and 23rd in Toronto. If you're interested, members of our community of practice funded by the Law Foundation of Ontario are going to be doing this work. So how did I get here? I'm going to say a bit about that, and then I'm going to situate health justice partnerships as an access to justice intervention and an example of people-centered justice. It aligns beautifully with the four pillars of people-centered justice. And then in my later presentation, I'll say more about the evidence and the knowledge for implementation and what law can learn from health, although it's throughout what's happened in terms of what I've learned from health. So I was a community lawyer and a legal clinic executive director for almost 4 decades. That's how I was first introduced to the idea of working with trusted intermediaries, and I'll say a little bit more about that in a moment, and building a justice ecosystem, as we do in Ontario in the community-based legal clinics funded by Ontario's legal aid plan. And I think my experience of the laws lived being so different from the law in the books in law school was an opportunity, a disorienting moment or series of moments that led me to think very differently about what it means to practice law and to be a lawyer in Ontario, which led me to the thought that the kind of research that was needed to create change in our communities at a grassroots level was nothing, what I learned in law school didn't help me with any of that, because it was community-based action research largely and participatory research that made a difference around what I now understand are the social determinants of health, the social and structural structural determinants of health that I'll say a bit more about in a moment. And I was very taken by the Access to Justice studies that started in Canada with Ab Curry's work with the Department of Justice, and then looking further afield to other countries, and the amazing work in 2013 by the CBA and others with the Equal Justice Report, the two reports that came out then, really got me thinking differently about early intervention and prevention. I knew we already did it. I knew that people's legal needs were intersecting. It was all confirmed by empirical research. So I felt like my lived experience as a community lawyer was validated, I think, by that. Then there was international knowledge sharing. I'm not going to go on about all the different things that happened, but it was all very serendipitous. And then the insights, as I've mentioned, from the social and structural determinants of health, and now I would say justice. That's an area that needs some work. And also the UN Sustainable Development Goal that's led us to 16.3 on access to justice, to this conceptualization of people-centered justice. So, this was a graphic I first created probably about 15 or 20 years ago for a future visioning session at an Association of Legal Clinics conferences about access to justice before we called it people-centered justice. But you can see, you probably can't read those little words, but those are all the players that are connected justice sector actors that we were envisioning, if we worked together more effectively, could leverage more resources for access to justice. And in my top upper right-hand corner, looking at it, is trusted intermediaries, which is where this health and justice partnership work fits. And what I'll say about that is there are many different groups of trusted intermediaries, and how we work with them is different. Health justice partnerships fall into members of the helping professions that we might work with more effectively. And when was this one, Jenny? Do you remember? That was like probably a good 15 years ago, some doctors in Toronto organized this. Rami, I don't know if you were there, about does your health depend on your access to justice? It's that wonderful, cool place in Toronto. I've forgotten the name of it right now. And they were talking, the doctors were talking about this and how do they connect to justice. And legal clinic people were there, and we all started to get excited about those ideas. I'm not going to say too much more about the social determinants of health because I must be close to time already, Rami, right? Yeah. So I'm not going to say too much more about that, except that these ideas are transformative in health, and getting them to think about more holistically, what does it mean to be healthy in our country? And I think we need to think in Canada, what does it take for us to be legally healthy, as a way of thinking about people-centered justice too. We have a colleague, Robin Nobleman, who wrote a fantastic article as she graduated from law school about access to justice as a social determinant of health, and I'm sure you're going to hear more from her in the years to come. Dame Hazel Gann in the UK has written about law as a social determinant of health. And as I've mentioned, health justice partnerships, without getting into detail, do align very usefully with the 4 pillars of people-centered justice. Thank you.
Thank
I forgot to mention the one thing before I forget. The Law Foundation did provide a little seed grant for me to undertake a study of impact frameworks for measuring health justice partnership work, which is a very important stage on my journey that led me to doing what I'm going to talk about later.
Hello? Lovely.
Hello? Is this working? Okay. Sorry. Thank you, Michelle. You were perfectly on time, and I was not at that conference in 2012, but good to know that this has a long history. So thank you. And next, Lachlan Deyong.
Good morning, everybody. I'm here to talk about methods and data as something that's pretty seismically and centrally important, and is not sort of a post hoc thing, but is actually one of the first things we should look at. So I deliberately wrote my slides. Each slide only has 3 or 4 words on it, sort of knowing that a lot of this presentation would be a response to what I've seen over the past day and a half and 10 years working in access to justice. My presentation is on why things are going backwards. Like there are some really commendable interventions, and I think everybody in this room has self-sacrificed and worked their butts off and done pretty heroic, gallant things, but access to justice is not going particularly well across Canada if you look at it in a broad and systematic way. So I'll push this up. I'm not quite that tall. So my presentation really is on what can we do to move the needle in more than siloed areas? Some projects are really great and make a big difference, and some projects aren't. And we are not consistent enough in calling a spade and saying this doesn't work, so that other people, other organizations in other provinces and territories don't do that same thing again. Like, I've got funded for projects that in hindsight, I probably shouldn't have got funding for, and I've been not funded for projects that I should have. And I know that, and nobody else knows that, and that's not in the reporting. So I'm sort of speaking on why access to justice interventions sort of struggle to move the needle. And I talk about Cochrane reviews, and I talk about Campbell as well, which are two sort of alternate models, not from law, that show a very effective visualization of what works and doesn't work. And I talk pretty briefly about how that's sort of one of the many things that need to be done pretty quickly. What do I do for work? I don't even know. I'm a legal innovation consultant, I suppose. Was once a sort of black letter law academic, was once a sort of insurance defense lawyer. Now I do the stuff that I had to do then off the side of my plate as my whole deal, my whole jam. My consultancy is called Law for Humans, and I do sometimes write reports, and I do sometimes do pilot projects, but not very often, because I haven't seen the evidence that lots of the things I've worked on have actually led to the outcomes that I wanted them to. I also co-run and co-founded a not-for-profit called Nomos Analytica Research Institute with a former CEO of Canley, and she's the law librarian, and we do really interesting sort of public interest work. I don't really use the word access to justice anymore because I still don't really know what it means. So I just talk about public interest legal things. I think this is my last slide second last slide before I sit down for a little bit. Why am I here? I mean, that's a broader existential question, but I suppose why am I physically standing behind this lectern right now? I'm here out of sort of hope that this conference, like, I don't really go to access to justice conferences very much anymore. I'm sort of here out of hope because I know lots of the people that ran and organized this conference, and I'm hopeful that this conference will lead to the material, substantive, pretty seismic change that's needed, rather than incrementalism or very noble siloed progress. So I'm here out of hope. Sometimes I think of the justice system as sort of being in sort of terminal decline, and sometimes I find conferences to sort of be a bit palliative care-esque. And I really do want to put an electrical shock into the audience and see if that permeates more widely. That's why I'm here today, and I only have one more quick thing. Oh, no, that's not me. Okay, actually, no, that is where I pause. I thought I had another one, but I suppose I don't. Okay, I'll be back in a little while.
Yeah, thanks, Lachlan. Yeah, your next slides are down the road. Okay, thank you. Next, I'll hand it over to Allison.
Thank you. I'm here today to speak about an ongoing randomized control trial evaluating the quality of forms produced using CLEO's guided pathways. For those unfamiliar with CLEO, our work focuses on providing information to people who face individual and systemic barriers to accessing the justice system. Our work includes legal resources and publications, the Steps to Justice public legal information website, the guided pathways, and CLEO Connect, resources for trusted intermediaries. CLEO's guided pathways are direct-to-public legal applications. They help self-represented Ontarians and those with limited representation learn about their legal rights, fill out forms and documents, and identify next steps. They are decision trees comprised of simple questions presented one at a time. They use information entered by the user to produce the applicable forms and documents, along with personalized tip sheets and instructions. Embedded throughout is public legal information helping people answer each question and understand the implication of their answers. Since the launch of the Pathways program in 2018, we've seen steady growth. Today, we have over 7,500 users a month. Alongside this growth, we've remained committed to ongoing and expanded evaluation, which has consistently shown positive results. In brief, we track use, including associated demographics. We ask for user feedback by way of an end-of-pathway survey. We also collect feedback from frontline workers who consistently cite the pathways as a critical resource. We conduct periodic spot audits to check quality assurance, and we have engaged Canadian universities for independent research validation. A bit more about research validation. With funding from the Law Foundation of Ontario, we supported an independent University of Ottawa and Western University study and randomized control trial on usability. In addition to data analysis, the study involved students completing the pathways while talking aloud. It found that the pathways can significantly reduce form complexity. This corroborated evidence we have from trusted intermediaries and stakeholders who routinely recommend the guided pathways to the public, and from user surveys. But this is evidence that the pathways reduce task complexity. And while we had evidence from our quality assurance checks, we wanted more research and evaluation on the efficacy of the forms the pathways produced. Our hypothesis is that the forms completed using the pathways would be a higher quality than those completed without. In partnership with McGill University and the Cyber Justice Laboratory, with funding from the Department of Justice, we designed and launched a randomized control trial to evaluate the quality of court forms produced using CLEO's guided pathways. The study asks whether forms completed using CLEO's guided pathways differ in quality from forms completed using a standard blank fillable PDF with resources generally available online. The study focuses on the guided pathway to complete a family law court form 8, one of the first interactive tools we launched and one of the most highly accessed family law pathways. And as the Form 8 is a foundational pleading document in a family law case, errors or omissions at this stage can significantly affect how the case proceeds through the court system. The study has a target sample size of 60 participants. Participants are recruited through CLEO's Guided Pathways platform and randomly assigned to one of two study conditions: a control condition in which participants complete the form using a standard fillable PDF, and an experimental or treatment condition in which participants complete the form using the guided pathways. Once the participant has completed the form, they meet with an independent family law lawyer who reviews the completed forms and the facts of the case. Following this meeting, the lawyer completes an evaluation of the quality of the form. Every participant who completes the study gets 2 free hours of unbundled legal services, regardless of which group they are in. So everyone is hopefully in a better position for participating in the study. While the independent lawyer's professional responsibility is central to the integrity of our analysis, our study in its entirety will be subject to a further independent evaluation by our academic partners at McGill University and the Montreal Cyber Justice Laboratory. For the purposes of this evaluation, there is provision, as necessary, for an independent case file review. I believe I'm at time, so I will pause there. Thank you.
Yeah, thank you, Allison. We look forward to hearing more about it in the second part of your presentation. Thank you for setting it up so beautifully. Now I will hand it over to Jenny.
Jenny.
Yeah.
Here, I'll grab the
Clicker.
clicker. Okay. Good morning. Hang on. Good morning. My name is Jennifer Stone. I'm the Executive Director of Neighborhood Legal Services, which is one of the community legal aid clinics in Toronto. Ours has been around for over 50 years, serving the downtown east communities. And I also manage a very special partnership that we have with the St. Mike's Family Health Team called the Health Justice Program. Our work really sits at the intersection of access to justice and ameliorating the social determinants of health. That's sort of our niche. So we provide direct legal services. We educate healthcare providers so that they can be those trusted intermediaries to issue, spot, and refer early. And when we identify patterns that implicate both access to justice and the social determinants of health, then we engage in systemic advocacy. So today I'm going to focus less on the service model itself and speak more about the evaluation work that has happened, and specifically how do we move from a strong theoretical framework for health justice partnerships to concrete facts about what these partnerships actually do, who they reach, and what impact they have. So the origin story, hopefully this slide will give you a bit of a visual picture about why it seemed really obvious for the family health team at St. Mike's and neighborhood legal services and the clinic system generally to start working together. So the top map is the catchment area of the St. Michael's Hospital's academic family health team. They have about 55,000 patients rostered. There are 5 physical clinic sites. They have about 80 physicians, 40 medical residents, and another 40 allied healthcare providers across about 28 subdisciplines. So it's a big shop. About 30% of their patient population lives under the low-income measure. The bottom map is neighborhood legal services catchment area, which roughly coincides with St. Mike's family health teams. We are 9 staff, and we serve approximately 1,500 people a year in housing, income security, immigration, and employment law matters, like most of the legal clinics across Ontario. And we serve about 1,500 people a year. All of our clients live under the low-income measure because of the financial eligibility requirements. So the Downtown East has a number of neighborhoods that you may know about: St. Jamestown, Moss Park, Regent Park, the Esplanade, the Church-Wellesley Corridor. There are significant newcomers, single-parent households, seniors living alone, and intergenerational, really embedded poverty despite all the cranes and gentrification happening. And so the partnership started really when Dr. Rami Shoucri was a medical resident at the family health team, and he led a legal needs assessment. Subsequent to that, funding from Legal Aid Ontario was received to pilot a health justice initiative for 3 years. And in 2019, that funding became a permanent part of neighborhood legal services funding. So what we do is 3 core activities. The direct service approach really is about reducing barriers for low-income patients to get a legal consult about their rights. So the theory of change is early intervention, or as some people describe it, preventative law. So based on the well-known reality that civil legal needs far exceed the capacity for legal aid and pro bono systems, so early identification and navigation are seen as crucial. Practically, this means that any provider within the family health team can refer a low-income patient to us. That EMR form in the bottom right of the slide is really how they do it sort of with ease. We also hold weekly drop-ins Friday afternoons at 4 of the sites. Every Friday afternoon in a month, you'll find us at one of them. And that's to also reduce that barrier that, the clinician doesn't have to be the bottleneck. People can come to us directly. So, these 3 pillars, direct service, education, advocacy, they all really interact in an organic way. So we take opportunities for lunch and learns, grand rounds, one-to-one provider, lawyer consults, any chance that we have to educate clinicians about potential legal issues impacting their patients, we do that so that they can issue, spot, and make those referrals early. And then when we see trends, recurring issues coming from the cases, coming from the issues that clinicians are seeing, then we look for opportunities to address the root causes through all the advocacy in all its forms. Since 2017, when Legal Aid Ontario gave us CIMS, the Client Information Management System, since this is a database, since this is a data conference, I'll mention it's it is a challenging system to work with. But since that database was introduced, we've served about 1,800 people through the Health Justice Program. That comprises about 20% of neighborhood legal services. Clients served, and that number seems to be growing year on year. We just did our annual report for the last year, and it was 35% of our clients now come through this pathway. So I think those are my introductory slides, and I'll chat with you later.
Perfect. Thank you, Jenny. So next is Elizabeth, and she will present in French, and she will be presenting both her background and her work and moving into the evaluation work that she has done.
Bonjour. Est-ce que oui? If some of you needs interpretation kits, so don't be shy and go get it parce que je vais parler en français. Donc, bonjour, je m'appelle Elisabeth Sigouin. Je vais vous présenter aujourd'hui le service d'accompagnement juridique à la Maison Bleue, l'importance puis les défis de l'évaluation d'impact. Je vais vous donner une perspective un petit peu de terrain parce qu'on est un organisme qui allie santé et justice, donc très terrain quand même à une échelle assez petite au Québec. La Maison Bleue, qu'est-ce que c'est? On accompagne les femmes enceintes qui sont en situation de vulnérabilité. On suit toute la famille jusqu'à ce que le dernier enfant ait 5 ans. Toutes les femmes qui viennent à la Maison Bleue ont plusieurs facteurs de vulnérabilité, que ce soit de la violence conjugale, de l'immigration récente, des situations financières précaires. Donc, il y en a plusieurs. Elles viennent à la base à la Maison Bleue pour un suivi de grossesse avec leur médecin. Ensuite de ça, par contre, on offre des services psychosociaux et psychoéducatifs. Donc, il y a une travailleuse sociale, une infirmière, une sage-femme, toute une équipe qui est dans une même maison. Tout le monde travaille ensemble. Donc, c'est vraiment un travail interdisciplinaire dans des petites maisons où tout le monde travaille ensemble. La mission de la Maison Bleue, c'est réduire les inégalités sociales en intervenant le plus tôt possible pendant que le bébé est dans le ventre de la maman. On essaye que les enfants arrivent à l'école à 5 ans avec les mêmes chances que tout le monde, peu importe de quel milieu ils viennent. Excusez, j'ai complètement oublié de changer la slide. Donc, ça, c'était la slide du début. La Maison Bleue, il y en a 5 à Montréal. On en a une à Montréal-Nord, à Verdun, à Parc-Extension, à Côte-des-Neiges et à Saint-Michel. Donc, c'est tous des quartiers qui sont dans des zones un petit peu défavorisées. C'est des petites maisons, comme vous voulez voir, qui sont assez chaleureuses et les gens viennent et tous les intervenants sont dans ces maisons-là. C'est une collaboration entre une OSBL, donc un organisme sans but lucratif, qui est la Maison Bleue, et on a des partenariats avec le CIUS, donc le système de santé publique, et les GMF, des groupes de médecine familiale. Donc, on travaille ensemble, on a des partenariats et ils sont tous les jours à la Maison Bleue, les gens du système public. Le service d'accompagnement juridique, il existe. La Maison Bleue existe depuis 20 ans, mais on fonctionnait sans avocat, on fonctionnait sans service juridique. L'accompagnement juridique a été seulement présent depuis 2022. 2 avocats ont été incorporés à l'équipe. Avant ça, les travailleurs sociaux, les infirmières, les médecins essayaient le plus possible de défendre les droits des personnes comme ils pouvaient, mais on référait souvent à l'avocat externe. Donc, il y avait toute une partie du droit qui était mise de côté, une partie fondamentale des enjeux qui était un petit peu dans une zone d'ombre. L'objectif du service d'accompagnement juridique, c'est que les familles comprennent mieux leurs droits puis puissent prendre des décisions éclairées. Qu'est-ce qu'on fait? On offre des services individuels, donc des consultations, on donne du conseil, de l'accompagnement. On fait aussi des groupes avec les familles au niveau juridique. On fait des démarches aussi avec eux. On fait tous les types de droits, que ce soit familial, criminel, immigration, logement. La proximité, c'est un des piliers de notre approche de la Maison Bleue en général, mais du service juridique aussi. Ça se traduit entre autres par un lien de confiance avec les familles. C'est toujours, les femmes viennent pour un suivi de grossesse, ils viennent pas pour me voir moi, ils viennent pour voir un médecin, puis après ça, hop, ils voient la travailleuse sociale. Tranquillement, la travailleuse sociale, par exemple, réalise que Madame n'a pas un budget suffisant pour acheter les matériels scolaires aux enfants. Pourquoi? On regarde le budget. Pas de pension alimentaire de monsieur. Ah, pourquoi pas de pension alimentaire de monsieur? Bien, je crois que ça va nuire à mon dossier d'immigration. Je crois que la DPJ va rentrer dans le dossier. J'ose pas demander. Ah, va donc voir l'avocate et la porte à côté. Eh bien, fine, elle s'appelle Elisabeth. Donc, c'est comme ça que ça commence, puis après ça, on embarque au niveau juridique. Donc, on a une approche un petit peu différente. Nous, c'est pas les gens qui ont besoin d'accéder aux droits. Donc, l'accès à la justice, on le voit pas comme quelqu'un qui doit se battre pour avoir des droits, mais on va où est-ce qu'ils sont, puis c'est nous qui allons vers la population. Donc voilà, et chaque sujet est abordé de manière interdisciplinaire. Donc, dans un dossier, par exemple, de pension alimentaire, il y a souvent de la violence post-séparation. Donc, on va travailler avec la travailleuse sociale, avec le médecin. On va essayer de trouver une maison d'hébergement, mais on va aussi parler de droit criminel puis de droit familial. Donc, ça, c'est un petit peu qu'est-ce qu'on fait à la Maison Bleue. Là, je vais commencer la deuxième section pour tout le monde. Donc, on va commencer l'importance de l'évaluation à la Maison Bleue. Depuis le début du projet, depuis le début de la Maison Bleue, l'évaluation est une préoccupation qu'on a en santé et en services sociaux. Donc, en 2015, par exemple, on avait fait une évaluation de la mise en œuvre du modèle et des effets, même de sa valeur économique. On avait des indicateurs, par exemple, les bébés de petit poids. On arrivait au même taux ou même meilleur que d'autres de la population générale. Les bébés prématurés, c'était quoi les résultats? Le niveau d'allaitement. Donc, tout ça était pris en compte dès le début parce que c'était important pour nous. Pour faire ces recherches-là, on avait de faire des collaborations avec la Direction de la santé publique, l'Université de Sherbrooke, l'Université du Québec, l'Université de Montréal, McGill, plusieurs universités. On a aussi une équipe à l'interne à la Maison Bleue de qualité expertise qui se penche sur différents indicateurs en santé d'année en année pour mesurer, pour voir c'est quoi nos effets. Au niveau juridique, dès le début du projet, en 2022, on a essayé de mettre aussi une structure d'évaluation pour vérifier, pour s'améliorer, puis pour voir qu'on atteignait nos objectifs. On a reçu des subventions, on a travaillé avec une firme privée à l'externe et avec l'Institut québécois de réforme du droit et de la justice vers la fin du projet. Le rapport n'est pas encore finalisé. C'est un projet comme de 4 ans, donc on n'a pas toutes les données, mais quand même, je peux vous en parler un peu, puis je pense que les résultats sont quand même pas mal. Donc, nous, depuis 2022, on a suivi à peu près 1000 personnes en droit. En plus des données quanti qu'on récoltait, où est-ce qu'on récoltait, par exemple, le type de droit, le nombre de clients, le nombre de rencontres, l'origine ethnique, la langue parlée, on tentait aussi de collecter des données au niveau quantitatif, au niveau du stress lié au droit à travers le temps, le niveau de compréhension des questions juridiques, la capacité à exprimer un besoin juridique, les réflexes initiaux en droit. Donc, ça, c'est ce qu'on a essayé de faire le plus possible, mais aujourd'hui, je pense que ce qui est intéressant, voilà. Ce qui est intéressant, je pourrais vous transférer, ceux qui seront intéressés, les résultats de la recherche, mais je pense que ça peut être intéressant de discuter des défis qu'on a eus dans cette évaluation pour un organisme terrain comme nous. Donc, déjà, la première chose, c'est comment est-ce qu'on peut mesurer ce qu'on évite. On est un service préventif. On essaie d'éviter des problèmes. En droit aussi, on essaie d'intervenir le plus tôt possible. Donc, le problème de mesurer les non-événements. Oui, on peut calculer le niveau d'anxiété qui a peut-être diminué chez les familles quand ils nous ont rencontrés après quelques rencontres. Mais le dossier d'immigration qui n'a pas dérapé, la procédure d'expulsion qui n'a pas abouti, un enfant qui n'a pas été placé par la DPJ parce que les parents ont changé leur méthode éducative, ces impacts-là sont réels, mais sont difficilement mesurables. En tout cas, nous, on n'a pas les outils pour le faire. Il faudrait une comparaison avec les populations vulnérables qui sont dans la même situation, puis on n'a pas cet échantillon-là. Donc, ça, c'est le premier enjeu. Le deuxième enjeu, c'est aussi comment on fait une évaluation avec des populations vulnérables qui parlent ni anglais ni français dans bien des cas. Comment on s'adresse à cette population-là pour mesurer des concepts abstraits comme l'accès à la justice. Donc, au début, on prévoyait poser des questions directement aux familles par des sondages, par des appels, par des questions. Mais c'était pas hyper naturel, je vous dirais, de questionner des familles au moment d'une intervention avec eux. Ils viennent, elles sont vulnérables, elles ont des problèmes, elles sont anxieuses. Puis là, au début ou à la fin de la rencontre, poser une petite question sur tu coches de 1 à combien sur telle question, ça, c'était pas naturel. Donc, on a dû s'adapter. Puis aussi, les clients ne comprenaient pas toujours c'était quoi le sens des mots qu'on utilisait parce qu'on avait des interprètes, par exemple. Donc, on est allé surtout avec les interprétations des avocats. On se mettait des interprétations à faire, des questions sur la capacité de compréhension, le niveau de mobilisation. Donc, à chaque fois, on devait remplir des questionnaires nous-mêmes, les avocats, mais ça nous demandait beaucoup de temps. En plus, il y avait sûrement un biais dans nos réponses, dans ce qu'on inscrivait comme réponse. Malgré toutes ces difficultés-là, c'est quand même très important pour nous de mener ces évaluations-là parce que si on ne le fait pas, c'est nous qui avons le plus de contact, des organismes comme nous qui avons le plus de contact avec ces personnes vulnérables-là qui sont souvent pas pris en compte puis qui sont invisibles dans les études sur l'accès à la justice. Donc, si nous, on ne le fait pas, ben leurs besoins vont encore une fois pas être pris en compte. Donc, c'est important de le faire. Après ça, ça touche à la question des ressources. et de la capacité d'évaluation. Il faut le faire, mais comment on le fait? Donc, il y a évidemment, sans surprise, la question du financement qui est spécifique, qui est par projet, par discipline aussi. Dans notre cas, à nous, quand on allie santé et droit, bien, on cherche du financement en droit, on fait une étude sur l'accès à la justice. On a des sous en recherche en santé, on fait une étude en santé. Ça serait intéressant d'en avoir les deux ensemble parce que on pourrait mesurer, par exemple, comment est-ce que le droit influence le développement de l'enfant. C'est ça la mission de la Maison Bleue, puis ça, on ne le mesure pas. Parce que si on n'a pas les indicateurs pour ça, puis on n'a pas le financement pour ça. Évidemment, aussi la pérennité du financement. Là, on a eu de la chance d'en avoir un, mais c'est terminé. Comment est-ce qu'on continue? Parce que oui, on a une équipe à l'interne qui fait un travail merveilleux, mais il faut la financer, cette équipe-là. Puis c'est pas vrai que ça peut être simple, que ça a demandé beaucoup de temps de construire le cadre, ajuster les collectes de données et tout ça. Les pistes de solutions, ben, je vous lance ça, sûrement qu'il y en aura plein d'autres, mais c'est quelques-unes que j'avais. Il y a les collaborations avec le milieu de la recherche, comme on a fait en santé. Bien, il y a possibilité d'avoir avec des instituts de recherche en droit spécialisés en accès à la justice. C'est plus une entente à la pièce. Sinon, une autre possibilité, ça serait un cadre commun qui serait fait par un organisme spécialisé là-dedans, puis qui pourrait être appliqué, s'il est simple et accessible, par des organismes comme nous, terrain, qui n'ont pas la spécialisation, qui ne sont pas spécialisés en évaluation d'impact. Ça soulève quand même une question préalable de qui va monter ce cadre commun-là, comment, pour vraiment pouvoir aller capter les sensibilités des populations vulnérables. Il faudrait que les organismes terrains soient impliqués là-dedans. Mais même ces deux solutions-là, il y a la capacité interne qu'il faut quand même développer parce que même si on fait des partenariats avec les universités ou avec un cadre commun, ça va demander des ressources à l'interne. C'est pas vrai que ça décharge complètement. Il faut qu'on ait les ressources pour continuer à collecter les données, à mesurer, à comprendre, à ajuster, à faire des retours. Donc, voilà, moi, je pense qu'il faut financer et valoriser la capacité interne des organismes terrain. Donc, c'est ce que j'avais à dire ce matin. Merci.
Merci beaucoup, Elizabeth. That was amazing. Okay, so I will hand it over to Jenny now to share her reflections on evaluation of the Health Justice Partnership. Elizabeth, if you could pass the... okay, you got it. Thank you.
Okay. Merci. Okay, so I ended off by sharing that we had served about 1,800 individuals since from the period of 2017 to 2025. And that number is important, but it's really only the starting point, of course. It tells us that the pathway is being used. It tells us that healthcare providers are identifying legal needs and that patients are accepting referrals. But it does not tell us whether the program is achieving its theory of change. So that's the key evaluation question. Are we reaching people earlier? Are we identifying legal problems that might otherwise remain hidden? Are we preventing crises? Are we improving access to justice and potentially health outcomes through this partnership? So the next few slides are going to be the reflection on, you know, the successes, challenges, and forward-looking opportunities. Whoops, nope. Oh. Okay. So when thinking about evaluation, I love the idea of the Health Justice Program really being a container where we are across disciplines learning. So justice as a learning system, I feel like that's really an in situ example. So this panel is asking what the justice sector can borrow from health systems in terms of measuring effectiveness, sharing data responsibility, integrating prevention principles, and scaling reforms through collaboration. So for us, evaluation has had these three success challenges and future-looking opportunities. So I'm going to get into them in a bit more detail, but just the high-level overview is that the success is that we've been able to partner with researchers and students through the academic part of the family health team, and like a really robust research physician culture there. So we've studied the program from multiple angles. Dr. Andrew Pinto and the Upstream Lab through the St. Mike's, it's affiliated with MAP at St. Mike's. They carried out a 5-part evaluation of the program's first 3 years. More recently, Dr. Nav Prasad, who's also a physician researcher at St. Mike's Family Health Team and the Canada Chair for Health Justice, has lent the resources of his lab to analyze our stats going back to 2017 for the purpose of internal quality improvement. Anushka Rajaram, a Master's of Public Health student at the University of Toronto, did a practicum with us last summer and took some of the early frameworks that we've learned about through Andrew Pinto's work, through Michelle Learing's Measuring What Matters reports, and she's created sort of a living framework that we can use year on year. In terms of challenges, I'm going to get into some of the details, but to do research in a academic health setting, if you want it to be for generalized knowledge, it needs to go through the Research Ethics Board if you're dealing with research involving humans, and that is a very onerous process. And St. Mike's is actually known to be one of the slowest REBs to get approval through. So I've heard about different sort of teaching programs within the family health team where the academic year has come and gone and they've had to abandon their idea because it didn't get past the REB. So, privacy, so important, of course, solicitor-client privilege, personal health information privacy, and research ethics have to ground all of this, but they do make health justice evaluation particularly complex. And then in terms of opportunities, always looking to think about how we can evaluate those hidden legal needs within health systems. And by learning, hopefully we can help inform systems improvements to both access to justice and the social determinants of health issues. So this is a very dense slide. If you're interested, obviously you'll see this later. This was Andrew Pinto's 5-part evaluation framework. Got some funding from, as I mentioned, Legal Aid Ontario and the St. Mike's Foundation to carry out this research, this evaluation of the first 3 years of the program. So the first piece is, who came? What did we see? What were the issues? What were the demographics of the patients who were referred? With the presentation in the comments, there are links to some published peer-reviewed papers that came out of this evaluation. So there's a paper on sort of a descriptive of the program and how it was formed and who was seen. The second part is sort of comprised of a couple of parts of provider experiences, legal sector and health provider experiences. There were in-depth interviews with various providers across the partnership. And effectively, there was a survey of healthcare providers. 100% of them thought it was a great thing for their patients to have embedded legal services. But it was such a small sample size that, unfortunately, it wasn't submitted for peer publication. And then, Part 4 is the prospective cohort study, which recruited individuals before they met with the legal team, which was sort of the intervention, and then immediately afterwards, 3 months later and 6 months later. So the idea is to try to capture what changed as a result of that intervention. And actually, the publication is still forthcoming, but early indications from the research team really focus on our self-articulated wellness, stress, ability to navigate systems, confidence, seeing oneself as rights holders. And then Part 5 was also published in a peer-reviewed journal on what were the systemic advocacy projects that or initiatives that the partnership undertook. Why? How did they come about? What were the considerations? So a multi-part evaluation framework, and what I appreciate about it, as a non-researcher, I'm a lawyer, and I need to sort of translate all of this really great work to potential funders for the program. And so what I like is that it doesn't just treat evaluation as counting widgets. It really looks at outputs, but also experiences, capacity building, patient outcomes, provider practice, and systems level change. So it gave us a strong foundation, and the task is now to move on from like a one-time evaluation to a sustainable ongoing evaluation cycle. This was a fabulous poster about the five-part evaluation I just described that was presented at the National Center for Medical Legal Partnerships conference in 2019 at Georgetown University. And I have 1 minute. Excellent. Okay. So in terms of challenges, as my colleague from Maison Bleue just shared, how do you measure what didn't happen? This is the theory of change being preventative lawyering. We know that the program prevents crises, improves navigation, reduces stress, strengthens provider practice, and surfaces systemic issues. But these impacts or outcomes will show up across many systems, and they're not always captured in one database. So measuring what did not happen is very tricky. There's also data limitations and resource limitations, and we can only pull reports out of our system that we put in. So in a very, very busy frontline service, community legal clinic, actually having the resources to enter that information into a database is always challenging. And Dr. Nav Prasad's analysis of our stats from 2017 to 2025, comparing NLS cases with those that came through the St. Mike's pathway, actually it's a suggestive finding, but it gives us maybe a promising comparator lens to build on. It suggests that outside of the areas of clinic law, housing, income security, employment, immigration, all the other stuff is identified through the partnership earlier and seems to get people connected to the services they need earlier. So that's an interesting piece, that there may be something outside of clinic law, sort of expanding the offerings and being more user-centered offers promise. And then in terms of opportunities, I mentioned this living framework that we now have. We're going to be tracking some of the measures annually, the demographics, what do we see, what were the issues, but then some of the measures may be suited to periodic research projects. So these may be resident academic projects, law student projects, or deeper quality improvement initiatives. So we want to bring in story-based reporting, and we're also interested in a living systematic review that Dr. Nav Prasad is going to be leading, so that our evaluation practice remains connected to the broader evidence base. So really the opportunity is to evaluate the health justice program as both a service and a learning system, one that helps clients, builds provider capacity, and identifies patterns that should change policy. But if we want these partnerships to grow and improve and influence systems, we do need evidence. And I think that's probably my time.
Perfect.
Thank you.
Thank you so much, Jenny. If you don't mind passing the clicker down this way to Allison, who will share her experiences with the randomized control trial evaluation.
Thank you. We've learned a lot about administering a randomized control trial in an access to justice context. So a little bit more about this context. Participants are members of the public who are accessing the pathway to complete the Form 8. Early in the pathway, they are screened into an invitation to join the study. If they accept, a secondary eligibility screening and conflict check is completed by phone. Subject to the user's consent, they are randomly assigned to complete the form, either using the guided pathways or the PDF form. Users assigned to this group are sent the ministry's instruction guide, and they can use anything they can find online except for the guided pathways. You can even use ChatGPT. It's up to them. A CLEO researcher silently views the user complete the form via screen share. Once the form is complete, the participant meets with an independent family law lawyer for 2 hours of unbundled legal services to review the forms and edit them as necessary. After meeting with the participant, the lawyer assesses the quality of the forms using a structured evaluation rubric. The completed forms are assessed for accuracy and completeness of legal claims, requested orders and supporting facts, procedural compliance, whether prejudicial information was included, and whether the form was fileable. The lawyer also assigns a holistic quality rating ranging from no concerns to wrong. At the end of the study, McGill and the Montreal Cyber Justice Laboratory will conduct an independent evaluation. The study launched in July 2025 with recruitment ongoing. However, several early observations stand out. First, the guided pathways improved form quality more than we initially thought. While we thought the guided pathways helped, what we are seeing is that they help much more than we imagined. Pathway users were more likely to request the right legal claims and orders, include relevant supporting facts, and complete required sections of the form. Second, most of the non-pathway completed forms were critically flawed. They included inappropriate or irrelevant legal claims or were missing claims that the participant had intended to make or thought that they were making. They did not include corresponding orders for their claims, and they often omitted supporting facts entirely or included facts unrelated to the claims being made. Participants assigned to this group completed forms evaluated by the lawyer as infileable and categorized as wrong, meaning the forms either will not be accepted by the court or had a serious deficiency that would be materially prejudicial to the applicant. Third, in comparison, all forms completed by the pathways were fileable, and none were found to include information that was prejudicial to applicants. Finally, the step-by-step guidance that the pathways provides helped users to identify and provide the information they need to complete the form. Bottom line, the guided pathways substantially improve the completeness and quality of court forms. Lessons learned. The study has also highlighted some of the challenges of conducting an RCT in an access to justice context. First, recruitment has been challenging, even with the offer of free legal services. We originally estimated that we would recruit 5 people a month, but it has been more like 2 to 3 people a month. Though, we've taken a purposely passive approach and are now investigating the feasibility of a targeted outreach to frontline service providers, which we expect to dramatically increase participation. Second, recreating the process of completing a legal form in a research setting is difficult. Even with real participants and real legal problems, the research environment is not the same as completing a form alone. We prioritize the integrity of the study by ensuring that the form filling process was completed the same way with both groups for every intervention, recognizing that, in reality, these forms are completed in varied timeframes over varied paces. Third, case criteria and complexity are difficult to quantify. Family law problems are highly personal and variable. We've excluded certain types of claims, for example, instances of violence or concurrent legal proceedings, to help manage this, and for other reasons. But even controlling for claim type, there can be significant differences in case complexity, and this may not be evident until the lawyer review stage. At the same time, the work to date has demonstrated that an RCT, while resource intensive, can evaluate the efficacy of direct-to-public legal applications in an access to justice context. In closing, data collection is continuing towards the full sample of 60 participants with a full data analysis to follow. In the meantime, if you would like to learn about CLEO's research, please visit our CLEO Connect website. We also welcome feedback and questions on this research initiative. And of course, pathways more fully. I have included my email here if you wish to connect. Thank you.
Thank you, Allison. Okay. Do you mind just passing the clicker? Lachlan, are you going to come to the podium or? Okay. Thank you so much.
Just going to see how many slides I have before. 1, 2. That's a big deal. Okay, great. You get me for a few minutes now, sort of putting out my whole thesis to see what stands up. So what do I want you to take away from this presentation, lecture, talk? I think one of the things that I really want you to take away is keep going, keep doing access to justice work. It's extremely dispiriting and tiring and exhausting, but extremely important. So to the people in this room speaking who are working in access to justice, keep going. To the bigger organizations that may be represented here, Department of Justice, Ministries of Justice, major national funders, we need to create something bigger and broader than every individual group doing their own atomized, randomized controlled trials or assessments of their own projects. That's very valuable for them individually to do, but extremely challenging for those organizations to do. And when you're within an organization, sometimes it's extremely hard to understand or justify to say we could help 2,000 people or we could help 1,000 people and do a really strong, rigorous assessment of this. So this is a very real politic thing in my next few minutes. So what do I want the audience to take away? Keep going. And for the government and broader organizations that have the power, the clout, the funding, the significance, let's build something so that the CLEOs and the Maison Bleues of Canada can focus on their service delivery, on delivering access to justice, and that there can be an organization. I'm going to speak of two very relevant ones that are great models, and go from there. Next slide. Okay. So what is the problem with how we use evidence in access to justice? I don't even know if it's a specific problem to access to justice, and this isn't a call out to access to justice and saying access to justice does it badly and legal practice does it brilliantly. The issue is that access to justice organizations aren't funded, staffed, or equipped to do systematic reviews to allow the interventions that they run to be scaled. Or many of the organizations and individuals in the room do phenomenal work with tens, hundreds, thousands of people. If this banner saying everyone is, actually the thing that we're really committed to, we want millions or tens of millions. We want things that scale, things that stack. We want things that you can cut and paste and make some modifications in another municipality, region, nation, any of those sorts of things. We need something that works across Canada, lifts the bottom up, and scales incredibly well. So I suppose on this slide, do access to justice interventions really move the needle? I really want to define how I mean really move the needle, because again, I don't want to invalidate the incredible and commendable work that you all do. When I say move the needle, I mean for millions or tens of millions of Canadians, with the individuals that many of you work with. Holy gosh, it moves the needle for them and entirely transforms their life in seismic and meaningful ways. And I don't want to say that's not moving the needle. This presentation is not a critique of anybody in this room. This presentation is saying this needs to be brought to millions and tens of millions. And that's only going to occur through having a systematic approach to working out what works and also being candid to say what doesn't work. When I've done program reviews of things that I've run, I've been aware that if I say this was a waste of time, let's never do this, it's not good for me in the future or the organization or the funder or those sorts of things. But that's extremely important. I'm going to get to a Cochrane review and a forest plot and sort of show you a very badly hand-drawn version of those to sort of say what I mean there. But one of the most essential things is to be able to say this doesn't work. Other organizations shouldn't do this. This cost X, and thank you. And to scale, this needs to be cost a tenth of that per individual served. Is this a big deal? Yes, extremely big deal. I'm going to talk to the medical system in a minute. Is it really 1 minute left? Oh, gosh. Okay. I talked much longer than I thought I would. Okay. Well, I'm going to show you this thing. I don't know how many of you know what a forest plot is. This is just the conference program taped together. There's a vertical line up the middle. It's always in the middle of it. Each one of these lines is a study or an intervention or an action. If it's to the if and the square is how good, credible, substantive was that study. If it's a huge square, it might have been 1 million people. If it's a tiny square, it might have been 10 people. And the line both says, basically says what's the confidence interval. So what was actually supported in a range here. And the location of the square is what did it actually find. And the diamond is all of these studies stacked up, put together, say what? If it's on the right, it means this isn't good and we shouldn't do this. If it's on the left, it says this is great, we should do this. Further to the left, the better. Wouldn't it be incredible if we could do that with an access to justice intervention in Ontario and say, this is incredible, this affected 2,000 people, let's make it apply to 2 million across the country. There's also a non-medical version of this called the Canberra collaboration that even has criminal and social justice realms. It's not used extensively in Canada. This is eminently doable, but it's not going to be doable by any one organization. That organization would have to stop providing services and would have to just concentrate on this. No organization can do it alone. There needs to be something central made. There needs to be something substantive made so that every organization doesn't have to spend a huge amount of their time and funding doing their own evaluations. Thanks.
Okay, thanks, Lachlan. And to wrap up the presentation portion, Michelle, I think if you just start speaking, yeah.
Thank you. Thanks so much, Rami. I think the point Lachlan makes is a good one. We can't even get started on Campbell collaborations or systematic reviews until we have a lot more evidence about what legal services work and what justice sector interventions work. We are nowhere near. We're 30 to 40 years behind the healthcare professions around producing evidence that can then show up on your charts.
Yeah.
And that's part of why we're here, and actually part of why I feel that health justice partnerships are such a way in to bringing us a different understanding of evidence-based practice, because we don't have it in law, and I think that that's the biggest limitation. We're not trained that way. We don't understand the research methodologies. Probably what you've just presented to people and those words that you've mentioned are new to most people. They were new to me. So we started through, I'm not going to get into more of the backstory because it's something you could talk about for ages, but in the community that I work in, we started developing community-based health justice partnerships in 2015, 2016. There was sort of something going on in the air for us at that point in time, probably connected also to what was happening in Quebec. And I became, we've worked with people in the community, trusted intermediaries, for the 40 years I've been at the clinic in various ways, trying to create change. And the one sector we couldn't reach was health. They were never at the table. Part of it is the way things are funded and organized in Ontario. But when we started the health justice partnership work, I thought, oh my goodness, evidence means a lot to them. They are actually not going to introduce, and Rami's probably going to confirm this, they are not going to produce, and they're not going to do anything with us unless we can show that that intervention makes a difference. So forget working with people in health unless we can do that. So that ended up getting me off on a whole journey. And back to some of Lachlan's points, I think we have to look at what other people are doing. So it also caused me to look at what was happening in other countries where there's far more literature and studies than there are here, which then led to me trying to get some funding to get a little bit of space away from my executive director responsibilities to do a study on how could we measure the impact of these partnerships so that we could convince people that this was a good thing to do in our community. Although I have to say, they were already kind of excited because we took a needs assessment approach to what healthcare providers needed for their clients to make a difference. We already had a level of excitement, but I wanted more because we were forming a community of practice in Ontario's legal clinics about this and with other partners like Dr. Shoucri to look at this. So I ended up thinking I was just going to look at impact frameworks. Well, little did I know that I was going to go down so many rabbit holes trying to understand a different psyche, a different philosophical and pragmatic bent in the healthcare disciplines. So what I think these partnerships offer is actually hope. And I can tell you, after the first, because I started this about 25 years into my practice, I found such hope in the possibilities here because of how good healthcare is. Documenting and thinking about and creating innovation and measuring it, despite all the problems that they have, which are huge because they're trying to tackle systemic issues. So it's the interdisciplinary perspective, it's the different methods of research, it's their conceptualization of concepts like social accountability, evidence-based practice, health equity, social determinants of health. These are missing in law. It's a common cause with healthcare providers to make a difference. It's the early intervention and prevention. They're trusted. We're not, as lawyers. I know we don't like to hear that, but I'm sorry, it's true, especially amongst the marginalized and vulnerable communities that we serve in Ontario. And the interdisciplinary collaboration, I lived the whole experience of it, doing the study I did, which was supposed to be just about looking at impact, but ended up looking at how did these partnerships develop in all these countries? What do they call them? How do they know they make a difference? And it was, what do they call research? There were so many things that happened in the course of that. Anyway, I'm not even showing my slides. Here we go. Now I'm going to tell you a little bit about what I learned about the evidence and impact, just to show you this is one field where there is evidence. And I have to say, I am in such admiration of what you've done in Quebec, by the way, Elizabeth. It's amazing to hear this story. I'm sure Jenny is inspired too with that, and share all your observations about the challenges and difficulties and opportunities. Is really, really incredible work, and came to similar conclusions that I did in the report that I did. So thank you for sharing that today. Also brought hope. And so what do we know? So in other countries, they do systematic reviews of the evidence about health justice partnerships, or in the States, they call them medical legal partnerships. And this wonderful, brilliant, then PhD student, Sarah Bearden, with the help of law and health academics, did a systematic scoping review of the findings of do these partnerships make a difference or not. And I'm not going to go into all those details. They're on the slides, but it was about, yes, prevention, yes, helping people to access legal assistance, yes, some limited findings around improving health, yes, resolving legal problems, yes, improving patient care, and yes, supporting health service providers, yes, addressing inequalities, and also the potential for catalyzing systemic change. But not so many studies on that, although you didn't mention, but you folks did a bit of a study on the impact of your partnership on systemic change in Ontario. 1 minute's not going to do it justice. There's another slide about the 10 other systematic reviews and scoping reviews, one of which I was involved in, which was another learn by doing, not sure what I'm doing, exercise with people from the Queen's Faculty of Medicine about that. Very interesting exercise to figure out how you do that, but that's how they do things in health. They don't develop things without studying how to do them first. I wrote a paper for this initiative that some of you would have heard Rebecca Sandiford describing yesterday, the Knowledge for Implementation part of the series of Global Perspectives on People-Centered Justice. So it will go into the evidence, the challenges, what else do we need to know there. And I do want to say what law can learn from health. Only 9 things here, and there would have been one more I would have added to this, but I've mentioned most of them already. The idea of people-centered care already came from health, already came from the World Health Organization. Again, we're just only 30 decades behind. And frankly, I'm not still, my little dig at AI again, I'm not sure AI is going to get us there. To catch up that quickly, as you can see. And there's so much more I could say about competency frameworks in healthcare and the dismal comparison, the tragic gap between how they think about professional competency and how we do in law. It's actually a scandal. I have a very strong opinions on that. And sorry, and I'm over my 1 minute. I'm so sorry. And these are just all the things that we need to change based on the report that I did. So just a few things there, including evaluation capacity building, which we can see is happening, which is very exciting, and many more things. And these are all the things that need to happen next, things at a micro level, a meso level, and a macro level. I can't say them, but they're in the slides. And this is a way forward that we could move, and there's no time to talk about that. We actually need to have a new discourse, a new language. That's part of this change. This is all the same as people-centered justice. This is what it's about. This journey we are on is not for the faint of heart. And this is a little bit about what we're doing with our project in Ontario. I've mentioned in the fall, September 22nd and 23rd, the Law Foundation has funded this conference. I hope we'll see some of you there to learn more with us about health justice partnerships and the way forward, and from our international presenters who will be part of it that we're quite excited about. But there's more work that we're doing that we can't talk about, but maybe people will ask questions. Yes, thank you.
Okay, thank you, Michelle. So we could obviously spend a whole day, a whole week, and we've left about 5 minutes for questions. That was not the intention, but so many great things to present. So if anybody has any questions, yes, please use the mic up there and just briefly introduce yourself and your question. Thank you.
Christiane Sad from the National Consortium on Justice Training. Thank you so much for your presentation. I will definitely be in touch for all the lessons learned and potential projects with my with my work. But I have a specific question for Allison on CLEO. Did you identify opportunities to test this pathway steps to to justice pathways with the integration of the new public portal of the court's public portal for to help self-represented litigants and everyone with the forms?
Sorry, I'm a little bit hard of hearing, so
Okay.
I just want to ensure I
Okay,
heard the question correctly. So the question was about the integration with the new.
So in Ontario, there's a pilot project now in Toronto, but then it will spread across the province, the new online portal for court. So I see potential integration there. Is that under study or is it missed opportunity?
So right now, the focus of the study is on the efficacy of the court forms produced, the Form 8 produced. I will mention, I touched briefly on this, but the guided pathways are, you can also access them from the Ministry's Family Law Forms website. But when you also complete the forms, you receive an instruction document about detailed next steps. That includes the instructions about how to file your forms. We do keep abreast of changes and innovations, and so we ensure that those are up to date, especially for Toronto users, making sure that we're reflecting those changes. So right now it is the focus, specifically in the context of the RCT, it is just the Form 8, but the Pathways Program more broadly, the Family Law Guided Pathways Program, of course, does integrate those next steps in that instructions for filing. So you do get instructions about those next steps.
Hi, good morning, everyone. My name is Andrew Eckhart. I'm the staff lawyer at the Class Action Clinic at Windsor Law. Thank you all for your contributions today. I was wondering about sort of any reflections you might have from working with health practitioners and whether the work that they've done in health justice network type work, if the collaboration has changed their perspective at all in terms of being an advocate for their patients in a legal sense.
Well, okay, I'm not a panelist, but we did study that, and certainly there's definitely a change in how providers respond to these questions. We don't ask questions if we don't think that there's anything that we can help with. And having this partnership, having the resource has empowered, the healthcare providers to probe and to ask questions. We don't want to do any harm, but if we have an opportunity to support people with these challenging issues that may have legal solutions, then we ask and we can refer. And that has come out in any of the surveys that we have done with the physicians and the nurses and the social workers.
Oops, sorry. Go ahead. Okay, I can comment on it too, because with that little study that we did in the community that I worked in, so very micro level, but I think what we found out, with the help, by the way, of students that came in from OT and nursing into our legal clinic to work, which was totally innovative and was a major, again, catalyst for change. There's so many things you can't measure about the transformative impact of these partnerships. I mean, there's so much. Anyway, there was like 90% or more of healthcare providers reported they were better able to identify legal issues because of the project and more likely to refer patients for legal help, and 94% reported it was helpful to them, 97% reported it was helpful to their patients. So pretty huge. And when I whipped through that systematic review, but it definitely says that, and the other studies are also talking about that impact. So it actually is, it connects to the health and well-being of healthcare practitioners, actually, because this little anecdote about what happened in our clinic with the nursing students, the first group we had, fourth-year nursing students. And we were doing a joint presentation at the end of their practicum at our clinic to all the nursing students at Queen's University. And the students said, you know, people were telling us about social determinants of health for 4 years. We heard about social determinants of health. And it wasn't until we went to the legal clinic and we saw what was going on there that we understood the role that we could play around connecting people who had issues with social determinants of health to their legal rights.
Yeah, well said. And Elizabeth, did you want to comment as well?
Est-ce que ça marche? Oui. Je voulais juste donner des petits exemples que moi, je remarque vraiment que ça change la pratique. Les questions qu'ils posent, à force de m'entendre parler de pension alimentaire puis de droit, ben, il la pose la question. Il dit, est-ce que monsieur paye une pension alimentaire? C'est une question qu'il ne posait jamais avant. Si le bébé tousse beaucoup, on va poser la question, est-ce qu'il y a de la moisissure dans le logement? Le propriétaire, il fait quoi? Les questions sont posées. Juste ça, c'est du dépistage. Puis pour moi, c'est ça le droit préventif. C'est pas moi qui peux le faire. C'est pas les avocats, c'est les intervenants. Mais s'ils sont pas conscients qu'il y a une question à poser, ils la poseront pas. Mais si on les informe, puis on leur explique, puis ils sont en contact régulier avec des avocats, ils vont la poser la bonne question. Moi, ça fait une grosse différence.
Merci.
I should also...
I think, Michelle, thank you. I think we should probably wrap up. It's 10:17. But I hope everyone has enjoyed this panel and will join me in thanking all the panelists for their work and their contributions. And I'm sure we'll be outside if there's further questions too. Thank you, everyone.